If you're suffering from sciatica, it's a very painful condition which radiates pain down your leg. So what should you do first to try and help you to get better as quickly as possible? That's the subject of this video. My name is Nigel Wilman and I'm a physiotherapist in the UK, and I have been for the last 25 years, and I specialise in treating sciatica. So if you are really interested in getting better, you have sciatica, I also have an ebook which is free to download. All you need to do is click the link in the description. But first, what should you do to help yourself get better? Well, first of all, a quick understanding of what sciatica is. If you have sciatica, you have pain in your leg predominantly, but that leg pain is being caused by an irritation of a nerve in your lower back. So as the nerves exit the spine, in the gaps between the vertebrae, there is some kind of compression of that nerve at that level. Now, quite often you won't necessarily have back pain, but this pain is felt somewhere else. It's felt in the leg, and it's very, very unpleasant. Now, the first thing that we want to do when we're looking to reduce our leg symptoms is to identify aggravating positions or movements. Very simply, every time that we do an activity or position that increases our leg symptoms, then we are actually compressing that nerve more and therefore irritating it more. And if we are doing that, it doesn't matter how many positive exercises or stretches we're doing, it's going to mitigate the benefits when it comes to settling down our nerve symptoms and therefore our sciatica symptoms. So by identifying things which clearly seem to make our leg symptoms worse, we can then take steps to reduce our irritation. So our steps need to be, one, we need to obviously avoid activities and positions that increase our leg symptoms. Now, understanding our own individual aggravating positions and movements is very important, because sciatica is caused by lots of different problems. It can be different for everybody. And so people's aggravating and postures and positions and movements are going to be different depending on the course of their problem. So for some people, sitting for periods of time might increase their leg symptoms, or for others, it might reduce their leg symptoms. Sometimes walking or being upright can be relieving, and sometimes it can be very, very sore and debilitating in terms of sciatica. Lying down can be really nice for some people, but lying down for other people on their backs could be really uncomfortable. The important point is that you identify your own aggravating factors that make your leg symptoms worse. And then we can take some appropriate steps to help to reduce the irritation on the nerve and therefore quickly get on top of your sciatica symptoms. So obviously the first thing we want to do is avoid aggravating and postural positions, movements that cause increased leg symptoms as far as is possible in everyday life. Once we've identified them, we can take steps to avoid them as much as possible in the short term, and therefore that can take away some of the irritation of the nerve and improve symptoms. The next thing we could do is we could take medication. This would be from our doctor. Medications can be effective in reducing even the severity of leg symptoms and help us to relax those muscles and around the problem and to start to be able to move a little bit more. So it can be a means to an end to get you out of the situation you're in terms of lots of discomfort. Talk to your doctor about that, about possible alternatives you could use in terms of medical intervention for reducing your sciatica symptoms. And the other thing we want to do, we're always told to keep moving when we have back or sciatica symptoms, but the important nuance of that is that we need to keep moving to begin with in gentle ways. Gentle oscillatory ways help to reduce muscle tension and free up movement without causing that irritation on the nerve. If we try to stretch and move too much, thinking that the further we stretch, the better, then we can often overdo it. And actually, those can be things that can increase our leg symptoms. So I recommend that you do smaller movements when it comes to exercises, with slower movement, and do it in a way which is a gradual increase in speed and duration of movement. And that is a safe and effective way, usually, of increasing movement and decreasing leg symptoms. So I hope that's been useful to you, and you now feel like you've got a plan of action to try to improve your symptoms and get over it. And let me remind you that you have the opportunity to get my free ebook, which is in the description below, and I'd be happy to send that to you to get started, the Sciatica Recovery Roadmap.